The most commonly seen shoulder injuries in contact sports are dislocations. And these can be dislocations of the joint between the collarbone and the shoulder blade, or dislocations of the main shoulder joint. AC joint dislocations are frequently seen in rugby, and also, I know it's not strictly a contact sport, falling off bicycles. The main shoulder joint dislocations are very frequently seen in rugby, soccer, sports which involve grappling, such as Brazilian Jiu-Jitsu. So the most important thing is how you feel. And that's not how you feel immediately when the injury occurs, because often the adrenaline and the desire to continue competing in the game masks injuries. I would always advise people to err on the side of caution when it comes to leaving the pitch, getting properly assessed initially by a physiotherapist or whoever's in attendance at the game. And then, if appropriate, a period of rest, dicing, and rehabilitation. The shoulder's not responding to this in the desired manner, then further imaging and assessment. If, however, there is extreme pain and obvious deformity, then that should be assessed much more rapidly. The most common non-operative management is a period of rehabilitation. The focus of that is to regain the range of movement, but also control over the shoulder joint. That should often be supervised by a physiotherapist, and a lot of the time it involves strengthening the small muscles around the shoulder and improving the way the shoulder and the brain communicate, which is called proprioception. A small minority of injuries need surgical intervention, and many can get a good return to play without surgery. So that is a very tricky question to answer, because it depends on the severity of the injury. A simple sprain, return to play in 1 to 2 weeks with strapping if appropriate. A major reconstruction can be a season ender and take up to 9 months for a full return to play. So in terms of re-injury, if you've had a minor injury, it makes you vulnerable to a more significant injury. So it's important that you rehabilitate well from said injury and don't return until you're completely confident. Strapping and reduced playing time can have a beneficial and protective effect, but they can't entirely rule out re-injury. The return to play, also fitness runs in parallel with protecting your shoulder. So if you're up at the speed of the game, you're much more likely to be in a good position to make a tackle or go into a contact. Whereas if you're finding that you're blowing a bit, you might end up in a bad position, and that definitely increases your chance of getting injured. So I would advise people to look to build up their playing time after any kind of layoff.